Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what Aicardi Syndrome is, the history of Aicardi Syndrome, how Aicardi system affects the brain, symptoms of Aicardi Syndrome, and diagnosis and treatment of Aicardi Syndrome. Aicardi syndrome is an extremely rare neurogenetic disorder affecting mostly females. Aicardi syndrome is thought to be caused by mutation on the X chromosome, but the exact mutation and associated gene has yet to be identified. While affecting mostly females, males with Klinefelter syndrome may have Aicardi syndrome. Individuals who are diagnosed with Aicardi syndrome have a genesis of the corpus callosum, meaning the structure that connects the left and right hemisphere of the brain is underdeveloped or absent. Many also have chorioretinal lacunae, which are small holes in the back of the retina of the eye. The exact number of how many are affected by Aicardi syndrome is not known. In 2018, the National Organization for Rare Disorders estimated there were 300 to 500 cases of Aicardi syndrome worldwide. However, in 2020, the U.S. National Library of Medicine stated that researchers estimated that there were approximately 4,000 affected individuals worldwide. Despite the change in numbers, it clearly shows how rare Aicardi syndrome is. Aicardi syndrome was first described by French neurologist Dr. Jean Aicardi in 1965. Dr. Aicardi originally characterized Aicardi syndrome by three main features: partial or complete absence of the corpus callosum, infantile spasms, and lesions on the retina that look like yellow spots, also known as chorioretinal lacunae. Over time with research, it was discovered that not all females experience the three above symptoms, but there are additional symptoms. Symptoms can be lower tone in the head and trunk of the body, small head circumference, and spasticity in the limbs. However, retinal lacunae and seizures are present in almost all reported cases of Aicardi syndrome. Aicardi syndrome affects the brain due to the following developments. Heterotopias are groups of brain cells that migrated to the wrong area of the brain during fetal development, often associated with epileptic seizures, developmental delays, and neurodeficits. The development of polymicrogyria causes numerous small folds in the brain and an abnormally thick cortex. Pachygyria causes abnormal migration of the neurons in the developing brain, leading to too few gyri or folds in the brain. When it comes to eye development, developmental abnormalities in the optic nerves, small eyes, and distinct yellow lesions can be seen in the retina in the back of the eye. The development of columba or gaps and holes in the optic nerve can occur, resulting in pieces of tissue missing. Along with affecting the brain and eyes, Aicardi syndrome can also affect the body in other ways. Skeletal features such as missing ribs, butterfly vertebra, hemivertebra, and other spinal abnormalities are common. Vascular malignancy, hyper and hypotonia, scoliosis, feeding problems have been reported. Skin conditions, facial asymmetry, small hands, and cleft lips have also been reported. These symptoms occur in girls with Aicardi syndrome but are not under the diagnostic criteria. Symptoms may vary in severity and how many are present. Diagnosis for each patient is unique in severity and scope. Magnetic resonance imaging, or MRI, an eye examination to confirm presence of retinal lacunae is done to confirm a diagnosis of Aicardi syndrome. Treatment varies per patient, but common medications used to treat are vigabatrin, sodium valproate, clobazam, levetiracetam, and topiramate. Aicardi syndrome is difficult to treat due to the seizures often being resistant to medication. The keto diet, under the observation of a physician, can be used to treat seizures. Brain surgery is often not considered for girls with Aicardi syndrome because multiple areas of the brain can be producing seizures. For those who have had brain surgery, seizures often continued, but some saw a level of improved control or a seizure-free period. Additional treatments such as physical therapy, speech therapy, occupational therapy, orthopedics, and ophthalmology are used to help treat girls with Aicardi syndrome. The average lifespan of girls with Aicardi syndrome usually averages 8 to 18 years of age. Some women with mild symptoms have lived into their 30s and 40s. Very severe cases may not live past the infant stage. Life expectancy depends on the symptoms of the condition as well as the severity of the seizures. Highest mortality risk occurs in the first few years after birth and adolescence. Common causes of death are respiratory failure, infections, and SUDEP, also known as sudden unexplained death due to epilepsy. Most children with Aicardi syndrome have moderate to severe disability, both intellectually and developmentally. Many children with Aicardi syndrome will eventually learn to sit independently, be able to feed themselves, walk, and use short sentences. It comes down to the severity of the condition that will determine if it is possible. Aicardi syndrome is an extremely rare neurogenetic disorder affecting mostly females. Much is still to learn about Aicardi syndrome, such as its genetic origin and mechanism. Three main features are looked for to make a diagnosis of Aicardi syndrome: partial or complete absence of the corpus callosum, infantile spasms, and lesions on the retina that look like yellow spots. Aicardi primarily affects the brain and eyes, but can affect other areas of the body as well. Learning and developmental disabilities are common depending on the severity of the condition. Academic and research organizations such as Baylor College of Medicine and the University of California at San Francisco have engaged in research on Aicardi syndrome. Research focusing on the genetic basis of Aicardi syndrome is being conducted. Research studying genetic disorders affecting the corpus callosum are being conducted to try to find better ways to treat Aicardi syndrome. To learn more about Aicardi syndrome, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos on our channel and subscribe today. You have the power to defeat epilepsy.